Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Pork is a popular meat consumed worldwide, but it can pose health risks if not handled or cooked properly. Here are some diseases related to pork consumption and tips for maintaining a healthy lifestyle. 1. Trichinosis. Understanding trichinosis. Trichinosis, caused by the parasite Trichinella spiralis, is a potentially severe illness transmitted to humans through the consumption of undercooked pork containing Trichinella larvae. The larvae can embed themselves in the muscle tissues of pigs, forming cysts. When humans ingest raw or undercooked pork containing these cysts, the larvae can be released in the digestive system and mature into adult worms, leading to infection. Symptoms and health risks. Symptoms of trichinosis typically manifest within 1-2 days after consuming contaminated pork and may include muscle pain, fever, diarrhea, swelling around the eyes known as periorbital edema, weakness, and fatigue. In severe cases, trichinosis can lead to complications such as myocarditis, inflammation of the heart muscle, encephalitis, inflammation of the brain, and even death. Preventive measures. To prevent trichinosis, it is crucial to cook pork to an internal temperature of at least 145 degrees, 63 degrees C, measured with a food thermometer. Ground pork should be cooked to 160 degrees F, 71 degrees C. Additionally, allowing a resting time of 3 minutes after removing pork from the heat source helps ensure any remaining parasites are destroyed. Proper storage of pork at appropriate temperatures and avoiding cross-contamination with other foods are also important preventive measures. Promoting healthy cooking practices. Encouraging individuals to adopt healthy cooking practices, such as thorough cooking of pork products, can significantly reduce the risk of trichinosis. This includes educating the public about the importance of using food thermometers to verify the internal temperature of pork, especially when preparing dishes like pork roasts, chops, and sausages. By promoting awareness and understanding of trichinosis and its prevention, individuals can make informed choices to safeguard their health while enjoying pork as part of a balanced diet. 2. Salmonella. Understanding salmonella contamination. Salmonella is a type of bacteria commonly associated with foodborne illness, including cases related to the consumption of contaminated pork products. Pigs can carry salmonella bacteria in their intestines, and contamination can occur during slaughter and processing or through cross-contamination in the kitchen. Symptoms and health risks. Salmonella infection can cause symptoms such as diarrhea, fever, abdominal cramps, nausea, and vomiting. In severe cases, particularly among vulnerable populations such as young children, the elderly, and individuals with weakened immune systems, salmonella infection can lead to dehydration, bloodstream infections, bacteremia, and reactive arthritis. Preventive measures. Preventing salmonella contamination involves proper handling, storage, and cooking of pork products. It is essential to store raw pork at temperatures below 40 degrees, 4 degrees C, to inhibit bacterial growth and to use separate cutting boards and utensils for raw meat and ready-to-eat foods to avoid cross-contamination. Cooking pork to the recommended internal temperature of 145 degrees F, 63 degrees C, ensures that any salmonella bacteria present are destroyed, effectively reducing the risk of foodborne illness. Promoting food safety practices. Educating individuals about food safety practices, including proper hand-washing techniques, sanitation of kitchen surfaces, and adequate cooking temperatures, is crucial in preventing salmonella contamination. Encouraging consumers to be vigilant when purchasing, handling, and preparing pork products can help minimize the risk of foodborne illness and promote overall public health. 3. E. coli. Understanding E. coli contamination. Escherichia coli, E. coli bacteria can contaminate pork during processing or through contact with fecal matter. Consuming undercooked or improperly handled pork products contaminated with E. coli can result in foodborne illness. Symptoms and health risks. E. coli infection can cause symptoms such as diarrhea, which may be bloody, abdominal cramps, nausea, vomiting, and fever. In severe cases, particularly among vulnerable individuals, E. coli infection can lead to hemolytic uremic syndrome, HUS, a serious condition characterized by kidney failure, anemia, and low platelet count. Preventive measures. Preventing E. coli contamination requires thorough cooking of pork to the recommended internal temperature and adherence to proper food handling and hygiene practices. Using separate cutting boards for raw meat and ready-to-eat foods, washing hands and kitchen utensils thoroughly, and avoiding cross-contamination are essential preventive measures. Promoting hygienic practices. Promoting hygienic practices in food preparation and handling can significantly reduce the risk of E. coli contamination. Encouraging consumers to cook pork products thoroughly and to practice good hygiene in the kitchen, such as cleaning surfaces and utensils regularly, can help prevent the spread of E. coli bacteria and contribute to a safer food supply. 4. Listeriosis. Understanding Listeria contamination. Listeria monocytogenes bacteria can contaminate pork products, posing a risk of listeriosis, a serious infection. Listeria can survive and even grow at refrigeration temperatures, making it important to handle and store pork properly to prevent contamination. Symptoms and health risks. Listeriosis can cause symptoms such as fever, muscle aches, nausea, diarrhea, and headache. In severe cases, particularly among pregnant women, newborns, the elderly, and individuals with weakened immune systems, listeriosis can lead to meningitis, septicemia, blood infection, and miscarriage or stillbirth in pregnant women. Preventive measures. Preventing listeriosis involves proper handling, storage, and cooking of pork products. It is essential to refrigerate perishable foods promptly, including leftover cooked pork, and to consume them within recommended timeframes to reduce the risk of listeria growth. Thorough cooking of pork to the appropriate internal temperature and avoiding unpasteurized dairy products and ready-to-eat deli meats can also help prevent listeriosis. Promoting safe food handling. Promoting safe food handling practices, such as proper refrigeration and cooking techniques, can help minimize the risk of listeriosis and protect vulnerable populations from serious illness. Educating consumers about the potential dangers of listeria contamination and the importance of following food safety guidelines can empower individuals to make informed choices to safeguard their health. Conclusion. In conclusion, while pork is a nutritious and versatile protein source, it is essential to be aware of the potential health risks associated with its consumption and to take appropriate precautions to prevent foodborne illness. By understanding the diseases related to pork consumption, such as trichinosis, salmonella, E. coli, and listeriosis, individuals can make informed decisions about food handling and cooking practices to minimize the risk of contamination and promote a healthy lifestyle. Emphasizing the importance of proper hygiene, storage, and cooking techniques can contribute to safer food preparation and help protect public health.